8 out of 10 chronic diseases, heart disease, type 2 diabetes, stroke, even many cancers, are not inevitable. They are preventable. That is not a motivational quote. That is the conclusion of one of the longest-running health studies ever conducted at Harvard University, following over 120,000 people for more than 30 years. And here is what makes this so important for you specifically. The people who avoided those diseases were not taking exotic supplements or following extreme diets. They were doing 5 specific things, consistently, every single day. Your doctor may have mentioned 1 or 2 of these. But the full picture, exactly what to do, in what order, and why it works, is rarely explained in a 15-minute appointment. That changes today. In this video, I am going to walk you through all 5 lifestyle factors, ranked from least to most impactful, and give you a clear plan you can start tomorrow morning. Stay until the end, because the most important factor is not what most people expect. 2. The root cause. Before we get to the solutions, you need to understand what is actually happening inside your body after 60. Because once you understand this, everything else will make perfect sense. There is a process happening in your cells right now called chronic low-grade inflammation. Scientists sometimes call it inflammaging, a combination of the words inflammation and aging. Unlike the inflammation you feel when you sprain an ankle, this kind is invisible. You cannot feel it, but it is quietly damaging your blood vessels, your brain, your joints, and your organs every single day. Think of it like a slow, smoldering fire inside your body. A small fire in a fireplace is useful, but a fire that never goes out, one that keeps burning at low heat day after day, eventually damages the entire house. After 60, your immune system becomes less precise. It starts sending out low-level inflammatory signals even when there is no real threat. This is not your fault. It is a natural biological shift. But here is the critical thing. It is not irreversible. The Harvard research shows clearly that specific lifestyle choices can dial that inflammation down significantly and measurably. Your body has the ability to heal. It just needs the right conditions to do it. 3. How the solution works. The science made simple. So how do lifestyle changes actually reduce chronic inflammation? The answer lies in something called gene expression. Your DNA is not a fixed destiny. It is more like a light switch panel. Certain habits turn on genes that protect your cells. Others turn on genes that accelerate damage. And the remarkable thing, proven across hundreds of studies, is that you can influence which switches are flipped starting at any age. The Harvard Nurses' Health Study and the Health Professionals' Follow-Up Study, the 2 largest studies behind these findings, tracked participants for over 3 decades. They found that people who consistently followed 5 lifestyle habits had an 82% lower risk of developing chronic disease compared to those who followed none of them. Not 20% lower, not 40%, 82%. That number should stop you in your tracks. Because it means the lifestyle you live every day matters far more than your genetics in most cases. And it means it is never too late to start. Now let us go through each factor, from least to most powerful. 4. The 5 lifestyle factors, ranked least to most powerful. Factor 5. Maintaining a healthy body weight. Score, 7 out of 10. The Harvard study defined a healthy weight as a body mass index between 18.5 and 24.9. And the data was clear. People within that range had significantly lower rates of heart disease, diabetes, and cancer. But here's what most people get wrong about weight. It is not just about looking a certain way. Excess body fat, especially around the abdomen, acts like an active inflammatory organ. It releases chemicals that increase inflammation throughout the entire body. Research shows that losing just 5 to 10% of body weight can reduce inflammatory markers by up to 30% in as little as 12 weeks. Warning: crash diets and extreme calorie restriction do not work for people over 60. They cause muscle loss, which makes everything worse. Slow and steady is the right approach. Practical tip: focus on reducing ultra-processed foods first, not portions. When you eat real food, your body naturally regulates appetite better. Start there before worrying about counting calories. Factor 4. Not smoking or quitting if you do. Score, 7.5 out of 10. This one may seem obvious, but the Harvard data showed it accounted for a significant portion of disease risk reduction. even for people who quit after decades of smoking. Smoking is one of the most powerful triggers of chronic inflammation known to science. It damages blood vessel walls directly, accelerates cellular aging, and depletes antioxidants that protect your organs. The good news: studies show that within 1 year of quitting, heart disease risk drops by 50%. Within 5 years, stroke risk approaches that of a non-smoker. Warning: nicotine replacement and medications to help with quitting are highly effective. Please talk to your doctor. Quitting with support is far more successful than quitting alone. Practical tip: if you are not a smoker, protect yourself from secondhand smoke. It triggers the same inflammatory responses in the body, even with limited exposure. Factor 3: moderate alcohol consumption or none. Score: 7.5 out of 10. The Harvard study found that moderate alcohol consumption, defined as up to 1 drink per day for women and up to 2 for men, was associated with lower disease risk compared to heavy drinking. However, newer research has complicated this picture. For people over 60, alcohol affects the body differently. It disrupts sleep, interferes with medications, and raises blood pressure more significantly than in younger adults. Warning: if you take blood thinners, diabetes medication, or blood pressure drugs, even moderate alcohol can cause serious interactions. This is one area where you must speak with your doctor before making decisions. Practical tip: if you enjoy a glass of wine socially, that is likely fine for most people. But if you are drinking daily to relax, consider swapping at least 3 evenings a week for herbal tea or sparkling water with lemon. Your sleep quality alone will improve within days. Factor 2: regular physical activity. Score: 8.5 out of 10. The Harvard study defined this as at least 30 minutes of moderate activity per day, and the results were dramatic. Regular movers had a 35% lower risk of heart disease, a 50% lower risk of type 2 diabetes, and a 30% lower risk of certain cancers. Exercise is the most powerful anti-inflammatory tool available without a prescription. It reduces inflammatory markers, strengthens the heart, improves insulin sensitivity, and protects the brain. After 60, the most effective combination is aerobic movement, walking, swimming, cycling, paired with light resistance training 2 to 3 times a week. That combination preserves muscle mass while fighting inflammation on 2 fronts simultaneously. Warning: starting too hard causes injury. Begin with 10 to 15 minutes a day and build gradually. Pain is a signal to slow down, not push through. Practical tip: a 20-minute walk after your largest meal of the day is one of the single most effective things you can do for blood sugar control and cardiovascular health. It does not require a gym, equipment, or a trainer. Factor 1: diet quality. Score: 9.5 out of 10. This is the most powerful of all 5 factors, and the one with the most room for improvement for most people. The Harvard study did not define a single perfect diet, but it consistently pointed to the same pattern: high in vegetables, fruits, whole grains, legumes, nuts, and healthy fats, and low in red meat, ultra-processed foods, refined sugar, and trans fats. This pattern, similar to what is known as the Mediterranean diet, has now been confirmed in over 500 independent studies. It reduces inflammatory markers by up to 40%, lowers LDL cholesterol, stabilizes blood sugar, and protects brain function. After 60, diet quality becomes even more critical. The gut microbiome, the community of bacteria in your digestive system, changes with age. And a diet rich in fiber and plant diversity is the most direct way to keep that microbiome healthy. A healthy microbiome means lower inflammation throughout the entire body. Warning: supplements are not a substitute for real food. A multivitamin does not replicate the hundreds of compounds found in a serving of leafy greens. Food first, always. Practical tip: you do not need to overhaul everything at once. Start with 1 replacement per day. Swap white bread for whole grain. Add 1 extra vegetable to dinner. Replace a processed snack with a small handful of walnuts. Small changes compounded over 30 days create remarkable results. 5. Your implementation plan. Here is a simple, practical routine to begin immediately. Starting tomorrow morning. Before breakfast, drink a large glass of water. Then do 10 minutes of gentle movement, stretching, chair exercises, or a short walk. This activates your metabolism and starts reducing morning inflammation right away. This week, add one vegetable or fruit to every meal. Not a full diet overhaul, just one addition per plate. And replace one processed food item in your kitchen with a whole food alternative. After 1 week, add a 20-minute walk after your main meal of the day. It does not matter if it is lunch or dinner. Just move for 20 minutes afterward, every day. What to expect? At 3 days, better digestion, more stable energy in the afternoon. At 1 week, improved sleep quality, less bloating. At 2 weeks, noticeably better mood, reduced joint stiffness in the mornings. At 1 month, measurable improvements in blood pressure, blood sugar, and energy levels. Talk to your doctor about checking your inflammation markers. Many people are amazed by the results. Always speak with your doctor before making major changes, especially if you are managing a chronic condition or taking medications. 6. Critical mistakes to avoid. Mistake 1. Trying to change everything at once. This overwhelms the brain and leads to giving up within 2 weeks. Pick one change. Lock it in, then add the next. Consistency beats intensity every time. Mistake 2. Focusing only on weight, not on food quality. You can eat 1,500 calories of processed food and still fuel inflammation. The type of food matters more than the number of calories for most people over 60. Mistake 3. Skipping resistance training and only doing cardio. Walking is wonderful, but without some form of resistance, light weights, resistance bands, bodyweight exercises, you will lose muscle mass every year after 60. That muscle loss drives metabolic decline and increases fall risk. Mistake 4. Treating supplements as a replacement for lifestyle. Fish oil, turmeric, and vitamins have their place. But no supplement has ever replicated the combined effect of a whole food diet, daily movement, and restful sleep. Build the foundation first. Mistake 5. Waiting until a diagnosis forces the change. The best time to act was 20 years ago. The second best time is right now. Most chronic diseases develop silently over 10 to 20 years before symptoms appear. The lifestyle you live today shapes your health a decade from now. 7. Mindset and motivation. Here is something most people have been told, sometimes even by doctors, that simply is not true. That chronic disease after 60 is mostly genetic and mostly inevitable. That belief has kept millions of people passive about their own health. But the Harvard data tells a very different story. Over 80% of the most common chronic diseases are driven by lifestyle, not genetics. That means you have far more control than you have been led to believe. Think about your grandparents' generation. They walked everywhere. They cooked real food at home. They worked with their hands. They did not sit in front of screens for 10 hours a day. Subscribe so you never miss a video. We bring you practical, science-backed health guidance every week, made specifically for people over 60. And please share this with someone you care about. A spouse, a sibling, a friend, someone who would benefit from hearing this today. That simple act of sharing might be one of the kindest things you do for them this year. Take care of yourself. You deserve it. And we will see you in the next video.